All right, so I really hate the term memory care when it comes to dementia because it's a lot more than just the loss of memory. And I get it. I get why institutions and businesses and everything talk about memory care because that's what most people notice about their loved ones. But dementia, if we're really going to get down to it, there are about three or four things that define dementia. And it's about two or three of them that qualify you to say this person is dementia. I mean, I'm talking about like in a very general sense. So obviously, memory loss, uh, cognitive loss, in other words, the ability to think or problem solve. And the third one is mood changes. And then you can throw in a fourth, which is maybe behavioral changes, maybe becoming aggressive or angry, aggressive or not taking care of oneself, not attending to one's personal hygiene, and so on and so forth. But memory loss, so there could be two or three without the whole obvious memory loss issues. Now, someone might argue that most things, most conditions, especially of the brain, will have some kind of memory loss component to it. But just focusing on memory loss makes, in my opinion, makes us lose out on the big picture. That it is a failure. The brain is failing, and that's what's happening. The brain is dying. Some people use that term. And if you're going to address that, you've got to address the brain as a whole. We began to look into this over 10 years ago because it was like we started, and I started with kids with severe brain damage. And then as we kept on and started getting success with our treatment and our approach, working with the government, we started having adults come to us with dementia and strokes and Parkinson's disease. So basically, we applied those same principles that we had learned and the successes we had gained from working with kids. We just applied them to adults. Obviously, we used higher doses. But the good thing was that because we had learned what was safe in kids, we could easily apply that to adults with really good results. So my point again is that it's not just about memory, because if you just focus on memory, you might miss dementia in loved one, or you might not bring them over for treatment early enough. And as we all know, early intervention is the best for any kind of condition, whether it's autism or Alzheimer's dementia. So look for changes. I think the number one thing is changes or variations from the normal. If your partner or spouse was a very mild-mannered person and all of a sudden it begins to fly off the top, becomes short with you, loses his or her temper, snaps at you, or they are not taking care of their body well, or they're wearing their clothes the wrong way, or they're wearing two different socks, or asking you the same question over and over again. Yeah, that could be memory issues, or just not being able to follow a conversation. The person asks, maybe everybody's in a conversation and the person not able to follow what you're saying and has to ask again and again. It may not be that they forgot what you said. It may be they did not understand it in the first place. So these are all things that can be red flags and can point you towards dementia. Another thing could be even imbalance when walking. That points the cerebellum, which is a part of the brain that has to be balanced. So there are all these little signs that I really want you to pay attention to, not just memory loss. Don't wait until the person has significant memory loss before you say this is something serious that requires the doctor's attention. These are all these little signs that I mentioned. Please pay attention to them, okay? Take care.